It's 6:41. Now to a Today's TMJ4 exclusive. How much radiation exposure is too much? A new study says more patients are getting dangerous amounts of exposure. Our consumer investigator Kristen Byrne reports.
Critically ill patients are all too familiar with CT scans and X-rays. Radiation-based imaging has skyrocketed in the past decade. We wanted to know who is keeping track of when enough is enough.
When he noticed one of his patients had undergone 100 X-rays, Dr. Sudhir Krishnan was concerned.
I said, surely someone is keeping a track of this. Some regional, local, or national authorities keeping a track on the amount of radiation exposure a patient typically gets in. And I realized that wasn't the case. There is nobody.
There is a standard federal limit for radiation dosage, but a recent Cleveland Clinic study revealed something shocking.
Some exceeded a number of more than 100 millisieverts within these 6 days. By federal occupational standards, that dose cannot be exceeded in 5 years, and we have that happening in 6 days.
As patients move from different facilities, the information about the radiation they have received is not transferred, which could lead to
patients could develop a certain kind of cancer because they've been exposed to a certain amount of radiation.
X-rays, CAT scans, and fluoroscopic surgery are the most common sources of radiation. But Dr. Charles Martin says something needs to change.
Improving communication amongst the multiple specialties to see if there's one way to get many pieces of information from one study.
Talk to your doctor about it and be sure to ask.
If there is no suitable alternative and it's absolutely necessary, then one would have to weigh the benefits versus risks and proceed with what's required.
The Cleveland Clinic is working to develop a tool that tracks radiation doses. It uses our electronic medical records as a home for all of this information. I'm consumer investigator Kristen Byrne.